2 days left to get here before your steak fry. I'm just saying, okay?
Or we won't vote for you.
Okay,
Wait.
there you have it.
Hang on,
Anyway.
that doesn't work.
That doesn't work.
We're trying to turn the screws to him to get him over here to come visit us, because he visited my radio show more than a dozen times.
Right.
Yeah, so we're trying to get him over here. But now time to put a smile on this, because it's time for great smiles.
Yay!
And look who's here. Dr. Steffany's here from Plaza Dental Group. And we're talking about something that is really, you say is incredible when you witness it yourself.
I know. So probably my favorite thing about what we do is witnessing people that they're embarrassed to smile, or they feel uncomfortable, or they don't go out in social situations, or they just they cover their mouth with their hand because they're embarrassed, and then watching them just completely transform and blossom. I mean, personalities change. People have told me they get better jobs, they have a better relationships, and they make more money and that kind of thing. So yeah.
I would bet there's research to support it.
There is research to support it, right? Yeah.
You said their personality becomes alive.
Oh my gosh, yeah. Well, imagine not wanting to open your mouth because you feel funny, or you don't want to, you don't want to smile. I mean, most of us take that for granted, that we can just smile and laugh, and
Because you're too embarrassed.
Right.
Yeah.
Yes.
Yeah. It's got to just depress you.
Jackie has that problem, right? She doesn't like to smile.
I'll be excited. I mean, I can't believe how quickly, to take in a total side panel here, I can't believe how much my 6-month smile quickly is working. Like, it's honest God truth.
Really?
Like, I wish this was invented for kids. So I didn't have to wear braces for 4.5
kids,
years.
we don't want kids to go fast. That's silly.
That's true. But it's
want them to suffer.
It's amazing how quickly they're moving my teeth, and I know they didn't have a far to go, but it's amazing how quickly they're working. But I can't wait for them to get off. So
the goal is to be done.
Okay,
so I can be done.
okay,
So I can smile again the way I know how.
Let's keep this in mind.
Smiling.
If this is the case, and when people have their teeth and they're straightened and they look awesome again.
Yeah.
Where's her personality going to go? Because it's already right here. Okay?
Well, it doesn't have it long, far to go.
Okay.
But let's talk about instances, because you've stated that if you don't fix a tooth problem or something, it almost can lead to depression. Can you talk about that?
And the funny thing is, the chicken and the egg here. The studies showed that people that rated their smile lower tended to be more depressed. So it wasn't necessarily, it causes the depression, but it certainly can be a factor, I think, when people don't feel, certainly we all want to feel good about ourselves, and I think that's fair. So
is it one of those things you don't necessarily think about? Women, I don't know about guys, but we think about, our hair.
I'm pretty sure guys don't think about it as much as
dressing and things like that. Is it because, when we can close our mouth and it goes away, that we don't always necessarily think about it?
I think it's such a psychological thing. It affects social, it affects relationships, it affects your work, it affects all of that. So, even when people whiten their teeth, they feel better.
Right.
So
and that's something really simple.
Yeah. It is very.
And there are a variety of reasons why people haven't taken care of it. Maybe they didn't have dental care growing up.
Right.
But you're saying that
a lot of it's fear. A lot of people. Fear is such a pervasive thing in dentistry. If you're not a psychologist when you go into dentistry, you'll become one by virtue of people are so reluctant to do it. And I think, imagine, as a child or an adult, somebody's coming down over you that you don't know what they're going to be doing. They have, it's a loss of control. It's a loss. You don't know what's going to happen. So you don't know if Jason's going to come out of the closet, and It's,
well, you can't necessarily. I guess I never thought about that. You can't necessarily see what you guys are doing.
Right,
you rely on hearing the.
And some people are fine. Like I don't have a problem with needles or dental care or anything like that. But some people, right?
That's the key right there, because you guys come at you.
Right.
If you haven't had your teeth worked on for a while, you say, okay, this is going to be painless. Then you come out and you have a needle. It's like this. Like, okay, open wide. Okay, and then you go and you just jam it in there, and then you see your hand up here. Then it goes way down here, so it's going to be poking out the back of your head.
Most people today, they have good experiences at the dentist. They come in and they say, wow, that is so much better than it used to be, or they'll say, that I can't believe you numbed me. It didn't even hurt, or things like that are just, we hear that every day, and you should. And the dentist. It's funny. Somebody told me that all the dentists in Polk County are 90% are University of Iowa grads, and they're wonderful So if you don't find somebody that really takes great care of you, find somebody that takes great care of you. You know,
because it doesn't have to be a
it
painful or
doesn't
fearful
have to be,
experience.
no, and somebody that's been doing it a while should be able to manage that fear and their, you know, and expectations and explain it so that you can understand that we're not trying to just, you know.
It's that important.
Terrible.
Yeah, taking care of your teeth is that important.
Well, it is, because
really is.
then, you know, I actually see a lot of elderly patients because I do a lot of implants, and so those people, you know, their life at a certain point becomes eating and socializing and, you know, chewing and getting nutrition in, and those things are so important at the end of people's lives. It's actually more important probably than it is earlier on, because what are you going to eat if you don't have teeth?
Is there a connection between inflammation and maybe diseased teeth, teeth that have trouble and heart disease, circulatory issues?
There's a ton of research about that. I'm glad you said that, because everything in the mouth, there's always bacteria in the mouth. If it gets out of control and the inflammation gets out of control, everything that you eat and drink goes past your mouth, right? So it goes into your system, and yes, they've found that the plaques in the arteries, the only other place that the bacteria and the plaques in the arteries lives is in the mouth.
Wow.
Really?
Yes.
So if you don't take good care of your teeth,
if you don't take care of your teeth, it can manifest in other ways. Yeah, absolutely. So yeah, of course. I mean, we used to think that, you know, I mean, which is silly. You think, well, that was silly. Why did they think the mouth was a closed system and it didn't affect anything else?
Right.
It's connected
It goes
to the rest of us.
right down here. Yes.
Yeah. So I mean, yeah, there's tons of research that shows that. It's very, very common now.
No, maybe somebody's watching now. They're saying, "Oh, I'm still afraid to go to the dentist,"
Sure.
or maybe I don't think I can afford to go to the dentist. What would you tell those folks?
Well, you know, there's lots of ways to. I mean, I never talk to people about budgets and that kind of thing. But at the same time, you know, there's financing, just like you finance, you know, cars and well, it's not like a car, obviously, but you know, something, you know, your furniture or things like that. I mean, there's so many ways to pay for it. It's not just hand me a check and a, you know, or a credit card and get it over with. Yeah.
Okay.
Yeah.
And like you said, finding a place that you're comfortable with, and knowing there's new technologies and new environments out there that are much more friendly than what you maybe remembered as a child.
There are people like you that are immediately comfortable,
right?
And there are people that just take a while. I've had patients that, you know, over several years, after a while, they finally loosen up. You know, not everybody's like we are that are comfortable with, you know, instant situations.
Right.
And we understand that. That's kind of obvious, you know, that everybody's different.
Right.
Yeah.
Maybe you guys fix the thing where when we're done, I can't eat soup for like 5 hours, you know, or your mouth just hangs open like that.
Yeah, there is a reversal agent. You know, we don't use it all the time, but yeah, if somebody really needs to, you know, get back to function, there's a reversal agent. Yeah, isn't that cool? Yeah.
Want to find out about the
idea.
reversal agent? What if somebody wants to chat with you? How can they get a hold of you?
Well, you know, our easiest way is dmsmiles.com. That's our website, and most people go there, and then they, you know, they find us that way. So
beautiful.
Lots of.
There you go. Great Smiles over on Jordan Creek Parkway. Perfect. Suite 100 West Des Moines. Good to see you again.
Good to see you guys.
Wonderful. It is 9:22.